Panekan District faced an unproductive generation threat due to stagnant progress in reducing stunting rates, triggered by a vicious cycle of poverty and a hidden epidemic of pediatric tuberculosis. Previously, bureaucratic silos between programs focused on nutrition and disease control failed to address the root causes. In response, Panekan Community Health Center launched TB-Stunting Hunter Squad, PUSPA Hunting. Magetan Regency faced a critical double burden of disease paradox. Despite the large budget allocation for nutrition interventions, the prevalence of stunting in Panekan District actually increased from 15.4% to 17.1%. The root of the problem was not a lack of resources but systemic failure caused by bureaucratic silos. Nutrition and disease control programs used to operate separately. Nutrition officers weighed children without examining comorbid infections, while tuberculosis officers passively waited for patients to come. This lack of synchronization caused severe underreporting. Despite rising stunting cases, the previous system recorded 0 pediatric tuberculosis cases in Panekan, indicating that the detection system was blind. This systemic blindness perpetuated a vicious cycle as undiagnosed TB infections undermined children's metabolism and weakened the impact of nutritional interventions. The PUSPA Hunting initiative seeks to break these sectoral silos. Without systemic reforms, Magetan risks a lost generation children who are physically and cognitively stunted, prolonging the cycle of poverty and hindering the achievement of SDG 2 and SDG 3. Motivated by past failure of passive approaches, treating TB without nutrition is slow. Giving nutrition alone is ineffective. The main strategy is service integration through the Hunter Squad, AE. Cross-professional team of doctors, nutritionists, TB nurses, and midwives who previously worked within bureaucratic silos now operate as a cohesive unit. The dual trigger. Protocol screens stunted toddlers for TB, regardless of showing no symptoms, and any adult. TB case triggers a nutritional assessment for all children in the household, uncovering hidden pediatric TB epidemics. Implementation follows. Treat the infection, feed the child principles, simultaneously treating TB and improving nutrition to break the malnutrition infection cycle. This solution is supported by a strong collaborative ecosystem. The TNI Defense Forces via Village, Supervisory Officers Babinsa, the National Police via Public Service Officers Panekan Tibmas ensures treatment adherence. Buskesmas Philanthropic Institution helps cover supplementary costs for low-income residents. The Housing and Settlement Office, Disperkim, renovates patients' homes through the Uninhabitable Housing, RLTH, program to improve ventilation. Educational institutions raise awareness on TB control and stunting prevention. This approach is humanistic and culturally sensitive, engaging village figures, health cadres, and village officials to reframe TB screening from shameful to an act of care for children. This initiative operates under a networked collaborative governance structure. Instead of a hierarchical approach, responsibilities are distributed through a tiered compliance protocol to ensure zero dropout in treatment. The tiers are as follows: Tier 1, Family, Primary Medication Supervisor. Tier 2, Health Cadre. If reporting is missed for 1 day, a cadre will visit the household. Tier 3, TNI Police. If missed for 3 days, Village Supervisory Officers, Babinsa, TNI Defense Forces and Public Service Officers. Panekan Tibmas, the Indonesian police, visit the household. Their presence symbolizes state protection, emphasizing that child health is a community security priority, not intimidation. The collaborative management is supported by a cloud-based, real-time digital monitoring system to track each child's daily progress. Funding is shared. The state budget, regional budget covers medical logistics, bouquet, health operational assistance, non-physical special allocation funds, DAK, supports cadre operations, village funds cover screening, tests and child nutrition, and Buskesmas philanthropic funds finance tests for low-income families. This structure ensures program sustainability, without reliance on a single funding source. We implemented the principle of radical efficiency through zero new hires and task shifting strategies, meaning no new staff recruitment or construction of new facilities. The resources were mobilized through the task shifting strategy. Through intensive capacity reinforcement, pediatricians transfer their knowledge to general practitioners at the community health centers, who in turn train nurses, village midwives, and health cadres. This creates a hybrid squad, capable of delivering high-standard early detection at low cost. Technically and logistically, we converted social assets into operational resources through a sharing economy model. Village halls became satellite clinics on screening day, and TNI Polri patrol vehicles were deployed to transport communities in hard-to-reach areas. This ad hoc strategy maximized the use of idle public sector assets to deliver services. Low-code, high-impact dashboard. We steered clear of creating cost-intensive, bug-prone applications. Instead, we developed the PUSPA integrated dashboard using a low-code ecosystem, Google Workspace and Looker Studio. This system converts field data input via digital forms into real-time geospatial visualizations. This digital map functions as a radar, guiding the hunter team to identify which villages experience spikes in cases or low medication adherence. This results in efficient decision-making, with interventions no longer based on assumptions but on precise data-driven intervention. Development cost, nearly zero cost, yet its impact is equivalent to $1 billion system. Discovery efficiency. PUSPA hunting uncovered a hidden TB epidemic among stunted toddlers and broke through the iceberg phenomenon of pediatric TB underreporting, long considered a root cause of stunting. Of the 541 children screened, 180 were confirmed to have TB, case yield rate 33%, demonstrating precise targeting of the underlying cause of stunting. Clinical outcome. All identified cases were monitored and provided with free treatment. As a result, 144 children, 80.5% recovered, while 35, 19.5%, are still undergoing therapy. In addition, 149 toddlers, 85%, recovered from stunting, with 85 children no longer classified as malnourished. Average monthly gains of 0.5 to 1 kilo in weight and 0.5 to 1 centimeter in height demonstrate a strong correlation between infection, treatment, and nutritional recovery. Monitoring also recorded no treatment dropouts, shifting their status from unseen and untreated to managed and recovering. Systemic and economic impact. Systemic impact was evident in the shift from passive waiting to active case finding. Public awareness increased significantly as self-referrals to Puskesmas rose from 0% 2021 to 70.30 2025. Village officials also allocated 10% of village funds for infectious disease control and nutritional support. Reinforcing program. Sustainability by reducing dependency on central government and health office budgets. This innovation precisely targets SDG Target 3.3, end the epidemics and communicable diseases, by uncovering hidden cases of pediatric TB, and SDG Target 2.2, end all forms of malnutrition, by treating stunted toddlers due to infection. Our approaches break down silos aligned with SDG Target 17.17, multi-stakeholder partnerships, integrating the Village Fund, the TNI Polri, and philanthropic organizations under a single ecosystem. PUSPA hunting demonstrates that TB elimination is an absolute prerequisite for achieving the zero hunger and good health targets simultaneously. It serves as a model of local innovation in support of the global sustainable development agenda. Top 3 insights for other cities. 1. Breaking silos. Integrating work units has a greater impact than increasing budgets for programs that operate separately. 2. A holistic view of nutrition. Malnutrition during stunting cannot be resolved solely through supplementary nutritional intake if infectious comorbid diseases, such as TB, are not identified and treated. 3. Smart and lean technology. Digital innovation does not have to be costly. A simple low-code data ecosystem that can be used by community health cadres is more sustainable than complex applications that are difficult to maintain. We believe that the TB-Stunting Hunter Squad, PUSPA hunting, represents not only a breakthrough in addressing the dual burden of pediatric tuberculosis and stunting, but also a replicable model of integrated, community-driven innovation. By breaking bureaucratic silos, leveraging cross-sector collaboration, and embracing a humanistic approach, this initiative has demonstrated measurable impact and sustainability. We are confident that PUSPA hunting can inspire other regions and countries to adopt similar strategies, ensuring healthier generations and advancing the global mission of equitable public health.